How does oxygen saturation affect COPD breathing? Have you ever wondered how oxygen levels in your blood can impact your breathing, especially if you have chronic obstructive pulmonary disease? Oxygen saturation is a measure of how much oxygen is bound to hemoglobin in your blood. It plays a vital role in how well you breathe and feel overall, particularly for those living with chronic obstructive pulmonary disease. In chronic obstructive pulmonary disease, the lungs become damaged. This damage causes airflow limitations and makes gas exchange less effective. As a result, many individuals experience low oxygen levels, a condition known as hypoxemia. This can lead to significant shortness of breath, making everyday activities more challenging. When oxygen saturation drops, it often worsens breathlessness. People with chronic obstructive pulmonary disease may find it harder to exercise and may experience a decline in their quality of life. Low oxygen levels can also increase the risk of complications, including flare-ups of the disease and even death. As the severity of chronic obstructive pulmonary disease increases, oxygen saturation levels typically decrease. This is due to a mismatch in ventilation and blood flow in the lungs. Some areas may receive oxygen but not enough blood, while others may get blood flow without sufficient oxygen. This mismatch leads to less oxygen entering the bloodstream, which contributes to feelings of breathlessness. To help manage low oxygen saturation, supplemental oxygen therapy is often used. This therapy aims to raise oxygen levels in the blood, improving symptoms and reducing the risk of complications. However, it is essential to manage oxygen therapy carefully. In some individuals with chronic obstructive pulmonary disease, especially those with high carbon dioxide levels, too much oxygen can be harmful. Normally, rising carbon dioxide levels stimulate breathing. However, for some, the body relies more on low oxygen levels to trigger breathing. Excessive oxygen can dampen this drive, leading to reduced breathing and increased carbon dioxide retention. To avoid these issues, oxygen saturation targets for people with chronic obstructive pulmonary disease are usually set between 88% and 92%. This range helps prevent low oxygen levels while also avoiding too much carbon dioxide in the blood. Monitoring oxygen levels and adjusting therapy as needed is vital. This careful management helps prevent complications like increased carbon dioxide levels, worsening acidosis, and further breathing difficulties. In summary, oxygen saturation significantly influences breathing in chronic obstructive pulmonary disease. It affects how well oxygen is delivered throughout the body and how the respiratory system functions. Maintaining optimal oxygen saturation levels can help reduce shortness of breath and complications. However, it is essential to manage oxygen therapy carefully to ensure safety and effectiveness.